Welcome to the Affirming Minds Podcast, where we equip like-minded mental health professionals with the therapeutic toolkit that helps add to a more engaging, fulfilled, and effective mental health practice. Each empowering episode can stand alone as a continuing education pod course or a very valuable professional or personal resource with insightful expert interviews, practical resources, industry news, and lots of inspiration. We help the modern therapist thrive at work. Now let's welcome your host, a dedicated therapist and passionate educator, Shaina Siber, LCSW.
Welcome to the Affirming Minds Podcast. I'm your host, Shaina Siber. I'm so happy that you tuned in today. This show is for educational purposes only and is not a substitute for professional treatment or clinical supervision. If you're in need of support, please reach out to a licensed mental health professional in your area. All clinical examples shared are fully de-identified, composites, or vignettes. No real client information is ever disclosed. If you're interested in earning continuing education credits for this episode, head to affirmmentalhealth.com. Our membership gives you access to CEs for live virtual workshops, self-study webinars, and eligible podcast episodes right here on the Affirming Minds podcast. I want to take a quick moment to thank Jane for sponsoring today's episode. Jane is an all-in-one practice management software that helps therapists streamline booking, billing, and charting. You can check them out using the link in the show notes. If you're ready to make the switch, use code AFFIRM1MO for a 1-month grace period. Welcome back to the Affirming Minds podcast. I'm your host, Shaina Siber. Today, we're diving into a subject that has long been a source of both fascination and fear: cults. The word cult itself is a sociological and colloquial term, not an official diagnostic or legal category. Many groups suspected to have cult-like elements based on the account of former members and researchers would never identify themselves in this way. In fact, the resistance is part of what makes recognition, prevention, and recovery so challenging. We've all seen the headlines and documentary from Jonestown and Drinking the Kool-Aid to the Branch Davidsons in Waco, and more recent cases like NXIVM. These high-profile stories grab public attention, but cults and high-control groups are far more widespread and less visible than we often think. They aren't just rare or sensational cases from the past. They exist in communities everywhere, across religious, social, and even digital spaces. For those who leave, recovery is never simple. It often means grieving deep losses, rebuilding identity, and learning how to trust yourself again. Survivors face unique clinical challenges around trauma, attachment, social reintegration, and as therapists, it's vital we bring trauma-informed, compassionate, and evidence-based approaches to this work. To guide us through this conversation, I'm honored to be joined by Dr. Alisha Powell, a psychotherapist specializing in mental health and couples therapy with expertise in racial trauma and religiously abusive organizations and cults. Dr. Powell holds a PhD in psychology and a master's degree in social work, and her expertise has been featured in Bustle, Fast Company, Healthline, Yahoo Lifestyle, and many other outlets. She currently works in private practice with individuals and couples, and she brings both lived experience and clinical expertise to this important topic. Now, let's dive into my conversation with Dr. Powell. Alisha, thank you so much for being here today on the Affirming Minds podcast. Before we dive into the topic, I'd love for our listeners to get to know you a bit. Could you introduce yourself to our audience and share what led you to focus specifically on cult recovery in your clinical work?
Yeah, absolutely. Well, first and foremost, thank you so much for having me. My name is Dr. Alisha Powell. I'm a licensed clinical social worker. I was originally born and raised in Alabama and moved my family to Georgia. One thing that really got me into just learning more about cult recovery and individuals coming out of cults was that my family joined a high control group when I was in my teens. And so we kind of lived off the grid in a way in Tennessee for a while and had a chance to kind of have the lived experience of being in a cult-like environment where everything that we did was really looked at closely, and there were a lot of rules and regulations. And so that experience was really what prompted me to do more exploration and really to hone in my clinical focus on individuals coming out of high control groups and cults just in general. So it was the lived experience, but also I think the combination of my educational background and being a therapist that really helped me combine, I think, some of those interests together.
Yeah, that is fascinating. And I really appreciate you being so open about your lived experience. Definitely sort of frames the lens you're coming from. And I also really appreciated such an interesting perspective that this was sort of a transition that you had in your adolescence. So it sounds like you have this experience of, your family being out of that environment and then sort of the segue and experience of being in it. And, I think we'll kind of get into that conversation as we talk through it of, what makes these sort of really high control groups appealing to people, what makes individuals or families maybe vulnerable to being susceptible to those broader control dynamics. So maybe we could just start by defining the landscape a little bit, kind of getting us oriented exactly what we mean when we're saying cult. What are the essential characteristics that distinguish cults from maybe other intense belief systems or other high control organizations or religions? How do you make that distinction?
Yeah. I think the biggest distinction is that of control, as
Mm.
far as a belief system that really basically overrides everything else. We're
Mm.
talking about individuals that really talk about separating people from family, separating people from friends, kind of a us versus the world mentality that really takes people away from their lives. It takes people away from things that they were previously doing and brings them into a very tight, closed, and insulated group where typically there's one or maybe even two identified leaders that have control of the group, and everything that they say goes, and the group members follow them a lot of times without a lot of questioning and without a lot of pushback. So I think it's a very a lot of times structured organization to a certain extent, but it's also something that is really deliberate when it comes to that control piece, but also that manipulation piece.
Yeah, no, that's really interesting. And it sounds like also what is just coming through is isolation and how isolation is such a key component of maintaining that control. Can you maybe speak more to that of how do cult leaders specifically, how do they form and how do they gain control over members, particularly from this psychological or sociological lens that happens?
Yeah. Well, typically cult leaders are individuals that have come from, I would say, a lot of times some type of trauma in their background. From what I've read about and from what I experienced personally, a lot of times they're showing signs of having some type of personality disorder where there's some inflated sense of self. There's really a big ego. There is I'm never wrong type of mentality or type of perspective on the world. And so part of their goal is really to bring people into their own belief system, and so they do that through a variety of ways. Number one is control, but also manipulation. But also, I think they speak to people's need to belong. A lot of times, cult leaders are very charismatic. They fill a need in some way. If somebody has lost someone close to them, if somebody is looking for answers, they fill that need in a way that really resonates with that individual and also really ties that individual to them and I would say an unhealthy enmeshment because there aren't a lot of boundaries. Boundaries are being crossed, there are lines being crossed, and they are very persuasive. A lot of times they talk a lot. They can be really well read. They can be good speakers, and they can be people that are looked up to, whether they are, physically attractive or they have a message that resonates with a lot of people. There's some type of magneticism that comes along with that leadership position.
Yeah, no, that's really, really, it's really interesting to kind of understand like what are the dynamics that can be so compelling and, you naming that seeking belongingness and also found what you're describing as people that kind of present with a lot of certainty in their own belief and that, being as manipulative as they can be, like to an extent that like being authentic, that they really believe in their correctness and rightness and righteousness, and I think in a world where there's so much uncertainty and things can be really painful, there must be some sort of feelings of safety when someone comes, especially that has a captivating personality or personality dynamics that has that certainty and is offering belongingness. Can you give us a sense of you gave us sort of a sense of those, like, mechanics behind it, but if we pull out, how prevalent would you say colds are today? I think sort of what gets traction is often the ones, like, that are very large scale, have a lot of media attention, but do you think that's, like, sort of an accurate depiction and that public awareness reflects the actual scope of the issue?
I think that's a great question. I think that our ideas on what cults are definitely changing as we become more technologically savvy. Cults aren't necessarily always individuals that are living off the grid in the woods somewhere in a remote location. Sometimes cults can be through social media. Sometimes cults can be through certain religious organizations or churches. Sometimes cults can be in neighborhoods where everybody's buying houses on the same street because they're all getting together because of a common cause. It could be a group of people just having a lot of things in common. But, when it does kind of cross that line is when there is like a very identified sense of control and manipulation, and group members are actively discouraged from leaving, or they're told that leaving will be detrimental to them in some way and they'll lose connections to family or they'll lose connections to friends within the group too. So I think that the landscape is changing as far as prevalence of cults today. I don't think we know how many cults there are just because it isn't really reported about. And most people that are coming out of cults don't necessarily know that they were coming out of cult, and they may not want to disclose that they're coming out of a cult because there's so much stigma, surrounding, hey, I left a cult, here's my story. Because people tend to think of individuals leaving cults as weak. They ask questions as far as why did you even get caught up in that? And it's hard to explain for somebody that's coming out the group why exactly they got in the group, especially if they haven't had a chance to really do some really intense, introspection, but also to even process with a therapist some of the things that led them to make that decision. Because it is, very nuanced. And each situation is so different when it comes to those personal, motivations and why they joined the group in the first place.
Yeah, no, absolutely. And I think sort of that intrinsic trickiness of when there is sort of a lot of manipulation and control, I'm sure identifying when you're in it, the dynamic, obviously they're not being promoted as cults, like come join our exclusive cult, so that sort of identification that probably happens on an individual level before it happens on a collective level is probably really hard, especially when there's so much risk of alienation and losing connection when you even start to doubt or think of that the collective experience and what. So once we kind of we're like kind of getting a sense of like how cults operate, who are the folks that might be at risk? Is there anything that either your clinical experience or research tells us about who might be vulnerable to cult recruitment? Are there specific developmental stages or psychosocial factors that increase risks for individuals or families?
Yeah, I think that's a great question. By and far, I believe that, the individuals that are a lot of times most vulnerable to cults are young adults. And that's typically individuals between 18, I would say, to 25 or so, because there's so much happening in life in that time frame. Typically, they're thinking about college, they're thinking about who they want to be as adults. They're outside a lot of times of, their parents or guardians' house at that point, and they're searching for answers, they're searching for meaning, they're searching for who they are. And they're also searching for a lot of times what they want to do for a living or what they want to do with their lives. And so as they're in this point of searching and looking for answers, they are especially, I think, vulnerable to individuals who are, manipulating them or seeking to manipulate them, for negative purposes. So I think overall young adults are really vulnerable, especially when it comes to, where they are in their lives and that sense of belonging, because a lot of times they've lost the protected insulated nature of their high school. They may be out in the world and they're looking for that friend group. They're looking for that sense of belonging and they're looking for their place in the world. And that's something that a lot of times that they find in some of these groups.
Yeah, absolutely. It's so interesting because that developmental stage you're describing of like emerging adulthood and, sort of those two things happening simultaneously of like losing a lot of like caregiver support, where you have to like really kind of take ownership of adulting and then also finding purpose. And I think, a lot of us generally, like there's a lot, I think a lot of listlessness. It can be really hard in today's world, and especially like in westernized culture where we have this like hyper individualistic sense of, you know, uh, success and purpose. And so to have a cult dynamic offer both probably like some caregiving in the control aspects, like kind of control being conflated for caregiving, but also sort of dictating purpose. Like this is like this belonging to this group and whatever that cult's ethos is, I'm sure it's like often grounded in like some sort of higher purpose. So I can see how that age group being so vulnerable to this like kind of these like recruitment efforts. So I think that's really key to think about like the timing and the context and the psychological development. I think that's a really impactful reframe because I do think there's a lot of stigma that must make it difficult when people leave it to. I was actually looking at something on, I think, like social media this morning where there was something about cult dynamics and I think there was comments about like me referencing like psychological weakness of people that get recruited. And it sounds like that's just a really unfair assessment of actually what might, make someone at risk.
Yeah, absolutely. And I think a lot of times when we talk about, what brings people to these groups, it's also that sense of family.
Yeah.
Because a lot of times individuals don't always have, the best relationship with family members or their family of origin. And so having someone that's creating a family of sorts is a really attractive feature if you are estranged or if you don't have a good relationship with family. That also makes people a lot of times more vulnerable to these groups.
Yeah, absolutely. And, like, again, I just appreciate your openness and sharing your own lived experience. But I think you also named you were coming in as an adolescent, right? So also the consenting process is also going to be very different for children and adolescents and people that are, very, very young adults, like 18, 19, that are being exposed in like these more familial recruitment efforts that can happen.
Yeah, absolutely. I think we don't always talk about the generational aspect of cults because a lot of times children or young adults are born into, that belief system or that group. And so if that's all that they've ever known, it makes a lot of sense that, it's going to take a while for them to leave or they may never leave because it's all that they know and that's their entire world. And so if your worldview is shaped from birth to that point, it's really hard and challenging to think about something differently or to see the world through a different lens when you've been indoctrinated for years with a certain belief system.
Yeah, absolutely. And that like in that sort of like inclusiveness and isolation is such a maintaining factor. So it's not necessarily folks that are born into it or getting exposure and then like getting to decide of like this is what I was born into. Is this like my choice? Am I still choosing this? Does this feel aligned with my values? Because it sounds like that sort of isolation against such a like a maintaining factor for them. So, what are some of the most common mental health challenges that emerge for individuals that have decided to leave a cold environment?
Yeah. The one that I've seen the most, honestly, has been depression and also grief. And really, honestly, a mixture of both, because there is a significant loss that comes along with leaving a high control group or a cult, because a lot of times they're losing their family or their family that they've created in the group. They're losing their friends that they found in the group. And they also a lot of times, there's a lot of unknowns. Many times people have left jobs, they've left careers, they've left homes. They are kind of recreating themselves outside of the group. And that can be a really daunting process when it comes to identity, when it comes to self-esteem, when it comes to self-confidence. And it also is that grieving process of grieving like a past life of sorts, because the worlds don't mix anymore. It's like in the group or out the group, but there really is no mixture. And so when people leave the group, they've also a lot of times had to make peace with the fact that they will never be in that group again. And that's a really hard goodbye if that's all you've known for all your life, or it's all you've known for a few years where your whole life was wrapped around it. So it's a really tricky process, but it's also one that I think has a lot of layers to it and one that does result in, I think, that mental health diagnosis of depression, but also a lot of grief and a lot of, I think, mixed emotions, happiness of leaving, but also the grief of leaving and also the sadness of grieving the person that you were versus the person that you are currently. And a lot of times having some regrets about that experience too.
Yeah, absolutely. I think that piece of like you kind of naming the identity piece of like there's like maybe some identity confusion or role confusion after somebody leaves is super critical. How does long-term exposure to uh, a coercive control group or a cult impact how somebody's identity forms? Especially you mentioned like young children or individuals who are born into a cult dynamic.
Yeah. I think the biggest piece is that you don't know how to trust yourself anymore. And when it comes to that intuition, when it comes to a lot of times those instinctual things that we, automatically choose without thinking about it, a lot of times people coming out of those high control groups really have to pause because they've always been told what to believe. They've been told what to do. They've been told how to dress, how to act, what to say. And so when that barrier is lifted or when those parameters are no longer there, they don't know who they are outside of who they've been told to be. And it can be a very overwhelming process because they're in a process of really having to build their own identity and figure out who they are outside of this belief system. And that's a hard process. It can be, emotional, it can have its ups and downs, but it also can be really scary for individuals because it's the first time they're doing this and they're literally creating a life without a blueprint because they don't necessarily know what they want their life to look like at that time.
Yeah, no, that's such a powerful way to say it, of just like trying to build a life without a blueprint. And yet going back to that greed part of just, again, I think the judgment when you're outside of it, of like, why would people stay in it? But I think recognizing like these different elements, that part of what's cultivating is like what it provides in terms of um clarity on belief system, better or worse, even if that does like feels like misattuned in a lot of ways, like community and collectivism and all of these other elements. And yeah, that's self-trust piece. It must be scary in some ways to be in a cult dynamic and start to question it and start to even have, and maybe it's not languaged like that initially of like, is this a cult? But like that, like languaging might not come together, but is this right for me? Do I want to continue to be in this system? Do I still want to continue to live like this? I imagine that must be like really terrifying in a lot of ways if it's coupled with knowing there may be so much loss in kind of continuing to entertain those thoughts and play them out.
Yeah, absolutely. It's definitely a process. And I think a lot of times it's a series of events that happen. I don't think anybody joins a cult planning to leave a cult. They a lot of times join planning to stay in it, until they die. And the reason for that is because they feel like they found the truth, they found the meaning that they've been looking for their whole life. There's a lot of I think there's a lot of security and emotional safety that comes in feeling like you have it figured out and you're good. As far as I have this area of my life figured out, I have a belief system that works for me. I have somebody that I trust, who this leader is, and I'm good for now. And so that process of starting to question, is this really the right thing for me? Is there something else that's different? It really brings about more uncertainty. And I think as humans, we are naturally just drawn to security and stability and structure. And so without that, it feels really discombobulating, but also can feel very anxiety producing at the same time because there's that internal struggle between this is what I'm told to believe, but I'm seeing something different than what they're saying. And a lot of times, cult leaders will tie what they're saying to eternal life or to salvation or to some type of afterlife that they're going to experience. And so the process of leaving also means that you're making terms with not getting to whatever that afterlife is or the next thing that the leader has been talking about. And that's a hard decision to make. And it's also one that is really strongly discouraged from the group. And so having that knowledge, knowing that you'll leave the group and leave everything that you've known through the group is really hard. And it also means that individuals, I think, experience high levels of anxiety even in the process of that pre-contemplation. Is this for me, and should I leave?
Yeah. And that, I think it's so important that what you're naming about like understanding how maybe beliefs about afterlife or salvation are tied up in this, because like just to speak to the strength of the people that wind up surviving cults and leaving and breaking ties with cults, because you have to then have that willingness to be in the uncertainty, right? Like, I think some of the maybe manipulations that are being maintained within a cult environment, getting out of the cult and like spending time in different communities or different like cultural frameworks can like debunk some of it. But like some of the pieces about salvation and eternal life and afterlife, like they just have to sort of, like you said, make peace with it. So that I think takes a sort of courage to be willing to move into the next chapter with that uncertainty being part of it.
Yeah, absolutely. And that's, I think, a lot of times what holds people back from leaving these groups is not wanting to leave that certainty.
Yeah. How do you help clients start to reclaim a sense of agency and self-trust as they're navigating that position, like that maybe that transition or contemplating that transition?
Yeah. So I think for me, I really try to take kind of a two-pronged approach, one that's really centered in narrative therapy, but also some solution-focused therapy at the same time. One thing I really work with clients about is really defining for themselves what they like versus what they've been told to like. And that process in and of itself can be a really long one because they're deconstructing all these beliefs. And a lot of times these rules that they were told were necessary for them to follow. And so just having them sit down and do that exercise of what do I believe or what, and then versus what have I been taught to believe? Because a lot of times those things are very enmeshed together. And so the whole prospect or the whole, I think, possibility of separating yourself from that belief system also means kind of creating a different self outside of that belief system. So we really start from the ground up. What are some of your core values? What do you find that gives you strength and support? What do your supports look like now that you've left the group? Who are some people that you can connect it with to have some sense of community so that you don't feel as isolated as you're really seeking to grow yourself, to, find out who you are, but also to really connect with people that are healthy and really, really, I think, invest in healthy partnerships and healthy relationships in a meaningful way that's outside of the group. Because that isolation piece is really big. And when it comes to the therapeutic process, I think that's the biggest piece that really leads to that depression because they feel isolated from the rest of the world because they don't fit into the rest of the world, but they are not in the group either. So they're in this weird, iffy, in the middle period where they don't feel like they fit into either world. And so as we're deconstructing, as we're talking about, what life looks like post group, a lot of it has to do with just the practical nature of, all right, let's talk about what you want to do for a career. Let's talk about, what type of hobbies you want to have. Let's talk about what type of friends you want to have. Let's talk about what you want to do for fun, what socialization looks like for you now outside of the group, when it comes to just doing daily things. And so really taking things, I think, step by step and not overwhelming them is so important. I think overall, just really staying with the client where they're at and not pushing. People may go to therapy and they may not be ready to leave the group. They may be in that kind of that contemplation, pre-contemplation, pros and cons, what's in it for me and what do I get out of leaving and what do I get for staying? And just being patient in that process as they're really seeking to untangle and unravel some of those belief systems, and some of those cognitive distortions that might be guiding their decisions.
Yeah, absolutely. I think that's like a beautiful approach. And I love using narrative, therapy and really letting people rewrite their stories. And it's just such an interesting question of like, how do we even know what we like? How do we know what we value? And so much of that comes from like curiosity and self-expression and being able to like explore things and get clarity because we don't like something or something doesn't feel right to us. And in an environment where there's so much groupthink and there's so many rules, I'm sure just like reorienting to even that exploration of trying to figure that out must be so liberating, but it also must be, like you said, overwhelming. So it sounds like you take so much care in the pacing of this process.
Absolutely, because there's so many choices. And so if you have a leader that says you need to believe how I believe and you don't need to think for yourself because I'm thinking for you, you kind of, in some ways, I think, delegate the thinking to the leader. So you don't necessarily always think about what you like and your own motivations and what you want to do next. So that whole process of reestablishing that for themselves. And if they have been in a high control group for a long period of time, they don't necessarily always have a reference point of what they were like beforehand, or if they were born into it, they don't have a reference point whatsoever. So we're really starting from scratch as far as laying the foundation for this new life, but also this new identity that is outside of what they previously had.
And now a quick word about our amazing sponsor, Jane. Can we agree on something? Therapists are already doing enough. They're managing care, notes, scheduling, billing, all while holding space for everyone else. The last thing you need is a system that makes it harder. That's why I switched to Jane. It's intuitive, it's beautifully designed, and it just works. It saves me time and protects my energy. The customer support alone is worth it, but the smoother workflow, that's what made it a long-term solution for me. Use code AFFIRM1MO to get a 1-month grace period. Switch to Jane and see what it feels like to be supported by your EHR for once. Time to decide if Jane's a better fit. Big thanks to Jane for supporting this podcast. And now back to the interview. What are some common misconceptions therapists or the public have about cult survivors that you wish that you could dispel just from, your lived experience in your clinical practice?
I think that the biggest myth is that there are no more cults. No. I think that it looks different depending on the cult that individuals were leaving from. But that misconception that, well, we're done with cults, that was something that, happened at a certain time period and we don't really have that anymore. I think that's a really big misconception. And I think that that's also, in some ways kind of a clinical gap when it comes to practice and also to research in general, because I think there needs to be more research, but I don't think it's necessarily something that's been a focus for a while, just because it's been something that there've been so many documentaries about, but not necessarily something that's been practically studied, I think, more recently here. So I think overall that misconception that there aren't cults, and then also the misconception that somebody coming out of a cult looks a certain way. A lot of times, we have, I think, our own misconceptions and stereotypes as far as what does a cult survivor look like. And the answer is anything. They walk among us. They're from all, walks of life. There isn't necessarily one standard individual that's coming out of a high control group or a cult. They look just like anyone else.
Yeah, absolutely. I think you're also that piece about like the research gap is so critical, especially because our world is changing, and I'm sure like cult dynamics, as you mentioned earlier, are changing to mirror what's going on in the world. So I think also something is like that, maybe culture living in commune together and everybody is in like, the shared communities. And I'm sure, of course, that is still the structure of many cult dynamics. But I think with like the internet and social media and these like global connections, when talking about influence, rigid rules, groupthink, like these things can happen for people that just connect in online communities. I work with people that there is certain elements of online life that take over their world, and that becomes much more time, much more connection in those spaces than in real world environments, connecting with people in their day-to-day experience. I think in that piece too, the vulnerability just expands so intensely because like anyone could reach anyone in this like highly connected digital age. And I think, the benefits are that are like more exposure to more information, and maybe that could be protective in a lot of ways. But I think it's probably also the scope of this can look so different than maybe some of these like very specific frameworks that we have of like, this is what a cult looks like. I think also like the scale, like I think also sometimes people like believe like cults are like really like these like really small communities. And then like when there's like some of these like bigger, more powerful organizations, and it's probably not super helpful to like name anything explicitly here, but that, I think there's more questioning if there is an organization that's gained a lot of power or notoriety or like has cachet because they have like high profile people involved. And I think those are some of the reasons, like, when the way you're describing a cult dynamics can be much more expansive, I think, than sometimes like how our most popular representations of.
Yeah, I think that's a really good point. And I also think overall, another one of the really common misconceptions is that, cults are always tied to religions or religious beliefs.
Yeah.
That is, I think, one of the biggest misconceptions about cults in general, because cults are really centered around a certain belief system. It doesn't really matter what the belief system is. It isn't always religious. It could be, centered around other things. It's not always kind of a religion or spiritual aspect to it. It can be something totally different, but it is some type of belief system or some type of value system that is controlling, but also closed.
Yeah, very interesting. Is there ever a, like a situation where a therapist can sort of mislabel what's happening, or maybe if there is like a concern that a client is in a coercive environment or a high control religion where it would actually be harmful to like label it a cult if like the client is not using that languaging or not seeing it or describing it in that way.
Yeah, I think that's very true. In working with individuals that are coming out of high control groups, I know I don't use the word cult just because there's so many. I think there's such a negative connotation to it. And no cult is ever going to say that they're a cult. So, if they go to the leader and ask, hey, are we a cult? They're obviously going to say no.
Yeah.
Most cults aren't really open about being a cult. And so I think using that language can be really off-putting to people, but also in a lot of ways really sometimes damage the therapeutic alliance that has been built already. Because no one wants to necessarily know that they're wrong or to find out that they're wrong. They really kind of need to discover it for themselves. So I think the biggest piece is just really asking questions, really being curious and asking more about the control aspect of the group. If you were to ever leave, what would the leader say? What friends have you told about this? What's the feedback that you've been getting from family or friends about this new thing that you're into? Just kind of asking questions, but also I think just being inquisitive and finding out more about that isolation aspect. Is the person calling them to leave their house or their family and to join them? Are they spending more time, let's say, online because of this, specific group? Are they not necessarily fulfilling some of their daily responsibilities and duties because they're really wrapped up in this belief system? Are they losing sleep because there's some type of requirement that requires them to stay up late or to interact with group members until early hours of the morning? So just finding out more. Also, I think taking that approach of, I call it like fascination instead of frustration, because I think a lot of times as clinicians, we can go straight to the frustration. Why are they doing this? If I was in their shoes, I would never, I would never do this. And, taking that step back and really taking ourselves out of the equation is so important, and really being able to meet clients where they are, but also to ask, reflective questions that really lead clients to the place of making decisions for themselves and really coming to that conclusion for themselves.
Yeah, absolutely. I love a fascination instead of frustration. And I think that's like a really nice way to stay in like the curiosity about it. And, it's just like also for me, like feeling so much overlap of even like the experience we have sometimes as therapists when someone is like in an intimate partner violence situation where like we may be like pushing and wanting them out and, having our own, sort of judgments and biases because we go into sort of a protective role, but kind of really checking our own bias, checking our own like agenda and kind of staying in that place of curiosity and support. And then also similarly, like that the entanglement that can happen, that it's sometimes so much easier to disentangle when you're like standing from the outside and you have no skin in the game versus when you really have those investment. I think something that moving to Arizona, I'm from New York, and I'm sure that this is not like something that doesn't happen in New York. But I think in where I happen to be in Arizona, there is sort of like more of a known understanding of there being some more of a presence of some high control religions and cults, and that being a little bit more on the pulse of like the clinical community here. And something that like I'm coming to understand too is like the financial entanglement. Like a lot of times there is a difficulty in like maintaining individual finances when you're in this sort of situation. So like your money is often like tied up in this organization or however it's structured. And so also leaving is also sometimes not tenable for very practical reasons as well.
Yeah, absolutely. There is a lot of control that goes around, I think, finances in general. And in the times that I have worked with survivors of cults, a lot of times that they've worked for free, they worked long hours, they've worked on a volunteer basis, and a lot of them have left their salary jobs and gone to work or to provide services to the cult, or they've kept their job, but all their salary goes to the leader, to the group. And so if they don't have access to their personal finances, it's another barrier to them leaving the group, because that's something that they have to really, establish for themselves. And that often means trying to connect with somebody that's outside of the group for that support or assistance.
Yeah, yeah, absolutely. Let's shift a little bit into what can help because it sounds like that you are doing fantastic work and really supporting folks that are coming from high control religion, the cult environments. So you mentioned narrative therapy and solution focused therapy. Any other sort of trauma informed approaches or things that clinicians should be thinking about in terms of what's particularly helpful in working with cult survivors?
Yeah. So I definitely think, the trauma-informed interventions can be really helpful. However, I think it's important to be careful how we pathologize religious trauma because there's so many layers to it.
Mm,
Because it's not necessarily kind of a one size fits all type of situation. Because religious trauma can really encompass people coming out of cults and high control groups, but it also can encompass people coming out of religiously abusive organizations or faith based churches that have significant, manipulation tactics as well. So really, I think doing that deeper dive of assessment, finding out how long they were in the group, finding out if it's something that they were born into, finding out more about that generational and family of origin component to that is really helpful in just crafting, I think, the best treatment plan possible. I know some people have recommended EMDR as really a kind of a trauma intervention. And I think that it can be helpful, but it really should be on a kind of case by case basis because when it comes to religion and spirituality, that isn't always something that is easily, I think, taken out of trauma. And so a lot of times it kind of comes back to that existential, the meaning of life and what does this look like for me right now versus, this is a deeply held trauma. And so being able to be trauma informed while also recognizing that these individuals are just creating their own belief system. And that in and of itself can sometimes be challenging, but also be traumatic because they're saying no to who they were before and yes to a person that they don't know that they've formed yet. So they're in this weird in between area of identity formation, identity development. And sometimes telling them that they're traumatized or telling them that they had a really bad thing happen to them isn't always therapeutically helpful in the moment. It's more about sometimes just being future focused, being strengths focused, and really kind of pulling on those internal strengths and really highlighting the importance of resiliency. And also, all right, let's talk about the plan. What do you want to do next? What do you want your life to look like? Do we need to go through your resume? Do we need to talk about job applications? Do we need to talk about ways to build some of those social supports? I think that the clinical work really extends just past, all right, trauma work. It really is kind of a all encompassing, let's create a life together because we're doing that kind of on a step-by-step process.
No, I think that's such an important nuance, and I'm so glad you sort of spelled that out so explicitly because I do like, especially when you're talking about the people most vulnerable. We're talking about very, very young adults. We're talking about people that may be born into it, like children, adolescents that are sort of transitioned to these environments. If that pathologizing, I could imagine being very shaming, right? And calling, when you have sort of been exposed to this and like now these are your values, these are your beliefs, this is your framework for the world. And maybe like part of it, you're not even walking away with it. Maybe you're not rejecting all of it. Maybe there's like very specific elements or I think in sort of, yeah, like kind of labeling it with a broad stroke, this is all traumatizing. The message could be like, this is all wrong. And like, that if this is very much part of how they see themselves and the foundation of their identity, like I could see that being incredibly shaming. And also, yeah, like not wanting to erase that. So I think that this idea of like building upon and, the future oriented, stance you're taking, why that makes so much sense and sort of having some cultural humility in approaching this.
Yeah, absolutely. I think that's a good point. And I think for a lot of individuals leaving cults, their experience wasn't all bad. And so kind of being able to tease out, all right, what did you learn about yourself in the process? And what's something that you can take away that's maybe positive that you can leave with that makes this experience at least have some meaning for you in a way that doesn't erase, like you're saying, all of the time and, what you believed before as you're starting to really form your new identity.
Yeah, absolutely. We had Melissa Perry, who's like a fantastic expert in high control religions. And she's talking a lot about how for some people who leave high control faith group, there's a lot of like religious scrupulosity and a lot of control dynamics that follow them into the next stage of their lives that they're still sort of maybe seeking control, like, but it sort of just manifests into different expressions of it. Is that something that you're ever noticing or working through with some of the survivors that you're kind of working with?
Yeah, absolutely. I see it all the time. One thing that I notice and that a lot of times will say to my clients is that coming out of a high control group or a cult gives you an irrational fear of making mistakes because
Uh,
everything is taught to you as life or death. And
yeah.
so if your whole life is divided into good choices, good place, bad choices, bad place, in essence, then you're going to have a lot of analysis paralysis because you're not going to want to make the wrong decision because you've been taught that it's life or death. And so when you are making decisions and when you are kind of processing and going through that anxiety that comes along with that decision-making process, I think that's a really unique component that comes along with leaving a high control group, is that fear of making mistakes. And that's something that, I think is so important to work through just in therapy, but also in other therapeutic avenues, because it is okay to make mistakes. It's okay to not be okay. But when you held yourself to this standard for so long, it's hard to let that standard go. And it's also hard to not feel guilty about letting that standard go because it goes against everything that you've been taught to believe.
Yeah, absolutely. No, I think that's such an important point, just how high stakes it could be and how that could potentially so easily push people into perfectionism or, just total avoidance and shutdown. And I think both of those things would make sense, if that is sort of your framework for making decisions, and especially if like a lot of that defaulted to a leader who was sort of idolized in so many ways. So yeah, what an incredible pressure then to be like, okay, like now agency, empowerment, all of these things that were so great, like that can feel like just such an incredible amount of pressure.
Definitely. And I think a lot of times people aren't prepared for the pressure when they do leave the group because it's all of a sudden the weight of the world is on your shoulders because you don't want to make the wrong decision, but you know that you need to make a decision. And so outside of leaving the group, every other decision is open. And so it's that process of just having some parameters, talking about their values, talking about their priorities, and then really starting to, I think, build on that foundation.
Yeah, yeah, absolutely. You were saying before, like how important it is to come from this place of fascination and not frustration, and just like not overly pathologizing their experience in the high control group. So for those folks that do have the opportunity to stay in contact with the group or their family members that may be still involved in the group in some way, is there anything that you're thoughtful about in navigating through clients who have that particular experience where there's still maybe like some connection to the group at large?
Yeah. So I think for me, I'm really cautious about like ever telling somebody never contact someone or they're out of your life and you should never, reach out to them again, just because there are so many layers and there is a lot of times a trauma component to it or a trauma bond that might be part of that dynamic when it comes to them having left that colder high control group. And also there's a lot of levels when it comes to that generational or that familial component because someone could have a mom, a brother, a sister, a partner, a spouse, still in the group that they do want to have contact with. And a lot of times the group is, they have a us versus them type of approach. So many times group members are not allowed to talk to somebody who has left the group. And so when they're reaching out and not necessarily getting phone calls back and text messages aren't being returned, that's also part of the grieving process as they're kind of dealing with that rejection from that family member or that friend that they thought might be the exception to the rule and reach out or say something or talk to them. And so helping them deal with that rejection, but also that expectation of this is what I thought it was going to be and it's different than what I thought it was going to be is I think a big part of that therapeutic process too.
Yeah, absolutely. And I think that piece of like you're mentioning not wanting to take on that role of, dictating their choices or telling them what's like right or wrong or telling them what to do. Some are sort of just like kind of modeling the very thing they're trying to escape from versus like giving them choice and like recognizing their inherent choice and navigating all of these relationships and the dynamics in the way that feels best for them.
Yeah, definitely. I think a lot of times when working with these clients, it's really helpful to kind of talk about things in terms of pros and cons to really kind of help them start to make more decisions for themselves, but also be more confident in those decisions too. So with my clients, we kind of explore different paths of action. All right, what are the paths? What are some of what are the pros and cons of each path? And really going through their values and identifying, all right, based on these pros and cons, this is what makes the most sense for this next decision and helping them get more confidence in their decision because they're going through the pros and cons and they're lining it up with their values and where they see themselves going can be really empowering, but also really, coming at it from a strengths-based, I think, perspective can be really helpful too.
Yeah, absolutely. Absolutely. So I know you've just really focused on rebuilding the next chapter of one's life, and that being such a integral part of the therapeutic process with survivors. What reintegration into mainstream society look like after leaving a cult? It would be so nice if folks came from out of these, stressful or high cultural situation into some sort of utopian society. But of course, our mainstream society has many, many complications and issues and pain itself. So what is that like? Are there challenges that arise or that you notice and just sort of moving into that next stage, just in dealing with like broader dominant cultural views?
Absolutely. I think the biggest piece is really helping clients to establish a sense of safety, which is really hard to do in today's environment and the climate that we live in. But even if it is just something small, as far as just feeling safe in their house, feeling safe, in the area that they live in, being in an area that maybe isn't super congested and where they have to deal with traffic on a regular basis, where it's maybe a little bit more peaceful. And so I talk to clients sometimes about just the benefit of maybe living in a place that isn't overrun with people where there's so much happening. Maybe the suburbs might be a good start, and maybe not downtown as
Right.
far as a place to move next. Maybe just, kind of having a routine, going to having a specific grocery store and really kind of establishing that sense of safety within a specific geographic area where you feel okay and where you feel like the people around you are okay as you're continuing to really develop your identity, but also to establish that sense of safety. And so we talk about safety awareness. We talk about, putting maybe additional lock on the door, things like that, just to really help with that internal angst that can come along with having lost that sense of safety, coming out of that group.
Yeah, absolutely. Yeah, I think that's a really like a practical approach. And I think you're just naming like some of the thing of like keeping structure because it sounds like going to like building some structure and foundational pieces that might feel stabilizing, after having such a transition, because I imagine so many things are changing. You're like a sudden like every element of life and maybe changing. So that sounds like really, to really ground people in their new environment is, I could see that really being a priority to establish safety. So for therapists who are new to this area, and I imagine many are, maybe I think, one thing that I always love about having, experts and people highly specialized, such as yourself on is you get such like an intense and specified view of like how to really take care of some like a patient population struggling with a particular issue or a certain community. And a lot of the way care is delivered is people go to community mental health clinics. They get like whoever their HMO will cover, or even if they're going to a group practice where they see, everything. And sometimes we will not necessarily, run into someone with this sort of issue because, they got connected to us because we're specialized, but because like they needed care, we were the care available, and like how do we now meet their needs? So for folks who may be encountering this experience that they run into someone who is leaving some sort of highly coercive group, or maybe even naming or sort of that suspicion that it is a cult environment. Are there some sort of like do's and don'ts that might just be helpful for to think about as a starting point?
Yeah, I think, honestly, the biggest thing I would say, and there are a few other ones, would be number one, just be mindful of your facial expression because there's so many. I think a lot of times clients can shut down because they see the look on our faces. If we look shocked or we look like we can't handle it and we say, oh, that's so bad. How could you ever get out of that situation? You're so strong for leaving, things like that. It really can shut people down because it can indicate that they're not really in a space to hear everything that they have to share. And so I think sometimes over empathizing can sometimes push clients away instead of, really building that therapeutic alliance, really trying to highlight their strengths too early in the process, telling them how strong they are in the first meeting usually isn't really helpful because they're coming because they don't feel strong and they usually have something else happening in their lives. So really being mindful of facial expressions and, looks of shock because, even though it is shocking, if somebody looks shocked when you tell them something, you may automatically not share as much because you're like, wait, this is a lot. I know it's a lot, and I'm already feeling self-conscious sharing this really deep, dark secret or this aspect of myself that I haven't talked about before. And so I think our reactions can sometimes push clients away. So being mindful of our reactions and facial expressions is super important. I think keeping it professional is also important, and really maintaining professional boundaries, because these are individuals that haven't really had a chance a lot of times to really establish personal boundaries. And so they may, have expectations of, around the clock phone calls, and they may text you at different hours, but really maintaining and also really being clear about the expectations of the therapeutic relationship is important too. As far as this is the work that we'll do together, and these are some of the boundaries of our therapeutic relationship, because there's been some boundary crossing if they've been in a cult-like environment or a cult group.
Yeah. No, that's so interesting too, that, like setting some of that frame and setting the expectations, because it maybe what's been conflated about us being like cared for is like led with like intensity and a lot of, yeah, like not a firm, individual boundaries being set, not wanting to conflate like these just very normative professional boundaries with like a lack of care. So it sounds like just naming that explicitly, enforcing them regularly, maybe like communicating like the rationale of why such like boundaries are in place for, and not just for the therapist protection, but like also primarily even for the client's protection. I think that's really critical. And I do really appreciate what you said about, the being mindful of our facial expressions and our reactions, because I think so much of the audience, myself included, the way that we know a lot about, both is through media representations, and some are probably more sensationalized than others and things like that. And I think that fascination from a clinical curiosity perspective is different than fascination from like how you're going to consume your favorite, true crime documentary for your reality TV show. So, not wanting to enhance those feelings of being otherized or like a spectacle in some way. And like how that can maybe get like reinforced in a way that could be painful. So I definitely appreciate that. And I do really also think of like that staying authentic and saying what you can know about somebody based on like building a relationship. I just find that to be like an icky thing in general. When you like meet someone and be like, you're so brave, you're so strong. It's like, I met you 20 minutes ago. Are you? Like, so
Mhm.
I definitely appreciate that. So this has been really fascinating, and I really appreciate you being here so much. Before we wrap up, is there anything else that you'd like to share with our listeners? Or really just, I think I would love to hear more about how people can connect with you and learn more about this important work that you're doing.
Yeah, absolutely. So I think as a takeaway, I really want to emphasize just the importance of really adopting that fascination versus that frustration when it comes to working with the individual coming from a high control group or a cult. I think it's really important for us as clinicians to meet clients where they are, and to be really careful that our own biases don't cloud our approach and our work with them. Um, Another practical tip would be just to really be mindful of the pop cultural references, because if an individual's coming from a high control group, they may not have that reference point of certain pop culture references. And they may feel even more othered because you're trying to connect with them and trying to kind of bridge that gap, but they don't have that same reference point as you. So just being mindful of what's being said, but also some of the pop culture stuff, because if they didn't grow up in the environment, they didn't go to high school like I did, then they're not going to have a reference point, and it's going to feel like they don't get where I'm coming from. So just being mindful of some of the smaller things that really make the biggest difference in that therapeutic alliance and that therapeutic rapport, I think is
Yeah,
important.
absolutely. No, I love that, because I actually am someone who does like use a lot of pop culture references in my therapy practice, and I think this is like one of the, like that cultural humility piece of really kind of considering that framework. I love that idea of like kind of just like getting into someone's world more and being fascinated about it and understanding like what did they have exposure to? Like what did they do for entertainment? What did they do for connection? Like what did their educational experience look like? And just really kind of getting into understanding in that way. And then adjusting and attuning your approach based on getting a sense of their reference point.
Yeah, absolutely.
I'm fascinated. You have me. I'm very fascinated, not frustrated at all. This was such a rich conversation. Thank you so much for being here. I appreciate it so much.
Yeah, absolutely. Thank you for having me. If folks want to get in contact with me, they can contact me through LinkedIn. I also have a Patreon specifically for clinicians that are looking for options outside of therapy. That's a great supportive community called the Pivoted Path. So they can find me there as well. And thank you so much again for this time and for, yeah, just having this conversation, because I think there's so much need for conversations about this.
Yeah, absolutely. So we will link all of that in the show notes, so you can get in touch with Dr. Alisha Powell and Affirming.
Thank you for joining our community on the Affirming Minds podcast. If you loved this episode as much as we did, please follow us wherever you listen to your podcasts and share it on your socials. If you want more information about how this podcast can add to your continuing education credits, visit affirmmentalhealth.com. And remember, let's affirm, heal, and grow together.